thyroid ay nandito sa anterior neck natin. Nandito siya sa ibaba ng ating Adam's apple. So ito yung Adam's apple, ito yung trachea, ito yung thyroid. It's a butterfly shape na meron kang right and left lobe connected by the isthmus. Now, paano natin masasabi na may problem sa thyroid? Titingnan natin yung function. If there's any problem in the function of the thyroid, like hyperthyroidism or hypothyroidism. Pag hyper, yung thyroid gland natin naglalabas ng maraming thyroid hormones at itong thyroid hormones na to ang nagsisirculate sa ating dugo. Mga symptoms niyan ay pagpapalpitate, kumakabog ang dibdib, nangangayayat, mabilis pagpawisan, mabilis mapagod. That is because of the excess thyroid hormones that circulate in the blood. Now, hypo naman is the lack of or the insufficiency of thyroid hormones. Kabaliktaran ang kanyang presentation. Tumataba ang mga pasyente, they become cold intolerant, nagsuslow down ang metabolism nila, bumabagal even the heart rate. So those are the two problems where the function of the thyroid is concerned. Now, may isang disease entity na kung saan ang thyroid function ay normal but they develop nodule. We call that nodular thyroid disease. Kung malaki yung thyroid, multinodular, non-toxic goiter if there are more than one thyroid nodule. Sa ganitong kondisyon, walang problema sa thyroid. Patient is not hypo nor hyper, but they have nodules. Yung thyroid cancer ay pwedeng mangyari sa isang taong may thyroid dysfunction. But of course, to diagnose cancer, you have to look at the thyroid, look at the nodules, because there are features of the thyroid nodules that will tell us that these nodules or this nodule looks suspicious. Maraming causes kung bakit tayo nagkakaroon ng problem sa thyroid. Now, hyper or hypo could be due to an autoimmune disease. That's number one. Meron tayong antibodies that are attacking the thyroid. So kapag nag-stimulate siya ng thyroid hormone production, naglilid to sa Graves' disease. We call that Graves' disease or Graves' hyperthyroidism. Another cause is radiation exposure. So kung nagkaroon ka ng radiation exposure, that can decrease the thyroid hormone production, pwede kang magkaroon ng goiter. Or nagkaroon ka ng nodules, not because of an autoimmune disease, nagkaroon ka ng autonomous production. Kasi ang thyroid natin, just like any other organ, can also develop nodules, but they don't have autoimmune disease. Family history is also a predisposition. Lack of iodine, like iodine deficiency, can also lead to goiter. Or meron pala silang thyroid problem na unknown and they were given iodine in different forms or amiodarone. So medications can also affect the thyroid. So those are some of the causes of thyroid disease. Some patients would say, Doc, meron akong thyroid. Lahat naman tayo may thyroid. Now, when the thyroid enlarges, you call that goiter. Now, alongside, when that goiter produces a lot of thyroid hormones, you call that toxic goiter. When that goiter does not produce thyroid hormones in increased amount, normal lang, then that is non-toxic goiter. So, goiter is just an enlarged thyroid. Pag hindi malaki yung thyroid natin, wala tayong goiter, pero may thyroid tayo. Hypo is more subtle kasi the symptoms will not present right away katulad ng sa hyper. Unless severely hypothyroid na sila, easily treatable ang hypo. Kasi ang hyper talagang when you come in thyrotoxicosis or thyroid storm, talagang very na yan, it's an emergency. Sobrang bilis ng heart rate mo. You can have heart rate of 140s, 150s, and irregular yung rhythm, mabilis, atrial fibrillation. Babagsak ang electrolytes mo, bumababa yung potassium, which are also deleterious to different organs, especially the heart. Nagkakaroon ng change in sensorium, no? Now, yung hypo, kung severely, ganun din naman. Very slow ang heart rate nila. Hypothermic naman sila, kabaliktaran ng naiinitan, malamig na malamig. They tend to retain water. Nagkakaroon sila ng effusion, yun yung mga severe hypo. Kaya if you will compare, mas parang dangerous ang hyper if left untreated. Ang mga babae ay naging mas commonly or have been noted to develop goiter or are diagnosed more frequently to have goiter because probably it's hormonally mediated. They say estrogen can be a driver, but several studies have tried to prove causality, but there's really no definite correlation. But of course, women are also more seeker of consults. Ang mga men, hindi ko naman sinasabi na hindi sila nagpapakonsulta. But mas conscious kaming magpakonsulta. That's why we get to be diagnosed more often. Mas common din ang autoimmune disease sa female. Meron din konting predisposition ang female gender in terms of autoimmune disease. Just consult your primary care. Not necessarily an endocrinologist. Madali namang ma-diagnose ang thyroid disease. And of course, you start with testing for the hormones. A good physical examination, not necessarily outright magre-request ka ng thyroid ultrasound. But of course, that would complement because by blood test, you'd know the function. And anatomic evaluation will complement the evaluation because alam mo na hindi siya malaki, normal siya, the parenchyma is smooth, wala siyang nodules, hindi siya vascular. You need to diagnose the thyroid disease first so that appropriate treatment can be given. So kung hyperthyroid ka, medical management. And then if the thyroid gland is big and you need definitive treatment, syempre merong dalawang options. Surgical after normalizing your thyroid function or radioactive iodine. Iinom ka ng iodine with radiation and that will shrink the thyroid. Untreated thyroid disease will affect the fertility. It's not the treatment. It's the dysfunction that will affect the fertility. So yung childbearing potential ng isang babae ay naapektuhan kung hindi mo gamutin yung sakit mo sa thyroid. Importante po na magamot natin ang thyroid problem natin, whether hypo or hyper, because that can also lead to death, no? Severe hypothyroidism can affect the whole body and the function of the whole body, including the heart, even the kidneys, even the brain. And the same is true with hyper. So if left untreated, then this could be fatal. Sa mga nanonood po na may thyroid problem, please don't hesitate to visit any of our clinics at Makati Medical Center. Marami pong magagaling na endocrinologist dito na tutulong sa inyong magamot ang inyong thyroid problems. For the treatment modalities, we are also complete. No? We also have good surgeons that can do thyroidectomy if the nodules look suspicious. We also have radiation therapy. And we also work hand-in-hand with oncologists kung medyo difficult to treat yung thyroid cancer ninyo. Don't hesitate to consult. That's the first step to do. And you can just come to Makati Medical Center for that.